In a dislocation, the ligaments holding the bones in the correct position of the joint are overstretched or torn loose. Because joints are rich in nerves, dislocations can cause a great deal of pain. Splinting reduces the pain and will also prevent further damage to soft tissue, nerves, and blood vessels. Joint injuries are managed in much the same way as injuries to a long bone. If you have not seen the video on splinting long bones, you might watch it at this time. Take BSI precautions. Explain the splinting procedure to your patient, gaining his or her consent to perform the procedure. Even minor movement during splinting of the joint may be painful. Prepare your patient for this temporary discomfort, assuring him or her that immobilization will minimize pain and further injury. Use a second rescuer to hold manual stabilization of the bones adjacent to the injured joint. Assess the patient's distal pulse, motor function, and sensation, PMS, prior to immobilization. If distal circulation is absent, realign the joint in the correct anatomical position or until distal circulation returns. If pain or resistance are felt or crepitus is heard, stop realignment and splint the joint in the position which you found it. Select appropriate splinting material. Formable splints and soft padding are usually used for joint injuries because of the precarious positions in which they present to the rescuer. Place the splint under the injured joint, padding as necessary, especially around joint angles. Gauze pads, towels, or other soft items can be used as padding. Secure the splint in place with cravats, an ace bandage, cling, or other fasteners. The device should prevent movement without constricting distal circulation. Swelling can be minimized by the placement of a chemical cold pack or ice pack at the site of injury. Be sure, however, that a thin layer of padding is used between the ice and skin so that damage is not done to the soft tissue. Reassess the patient's distal pulse, motor function, and sensation, or PMS. If the splint is applied too tightly, loosen it immediately. One special consideration is finger injuries. Fingers are immobilized using the buddy technique of splinting the injured finger to an adjacent, non-injured finger with tape and a tongue depressor if one is available. Signs specific to a possible dislocation or fracture of bones in the shoulder girdle, including the humerus, clavicle, or scapula, include a dropped shoulder or a situation where the patient holds the arm on the injured side against his or her chest. Do not attempt to straighten or reduce a suspected shoulder injury. Instead, treat the injury by splinting the shoulder girdle with a sling and swath. Following the standard initial treatment steps, prepare the sling by using a triangle bandage or folding a square cloth into a triangle. Position the sling across the patient's chest, aligning the top corner at the uninjured shoulder. Align the other corner at the patient's hip on the injured side. Fold the injured arm across the sling and chest. If the patient cannot hold his or her arm, have someone assist until you tie the sling. A small pillow or other padding placed on the patient's chest will ease the discomfort and/or pain of some shoulder girdle injuries. Take the bottom corner of the sling, located at the patient's hip, and bring it around and behind the patient's neck. If you do not suspect a spinal injury, draw up the ends of the bandage until the patient's hand is several inches above the level of the elbow. Tie the two ends of the sling together, making sure the knot does not press against the patient's back. Reassess the patient's distal PMS, making adjustments as needed. Draw up, twist, or pin the excess fabric at the elbow to make a pocket for the patient's elbow. Next, minimize movement of the shoulder girdle and upper extremity by forming a swath from a triangular bandage. Tie it around the patient's chest and injured arm over the sling. Do not include the patient's uninjured arm in the swath. If a second triangular bandage is unavailable, tape or cravats can be used to secure the arm and sling to the torso.